The FDA has proposed easing blood donation guidelines for gay and bisexual men.
Dallas Payton explains the new proposal and how it would impact folks in our area.
Under the current rules, the FDA allows donations from gay and bisexual men if they haven't had sex with another man for 3 months. The proposed plan would revise the current blood donor history questionnaire to ask all donors, regardless of gender, about new or multiple partners. Anyone with new or multiple partners and have participated in certain sexual activities within the past 3 months would be prevented from donating blood. If finalized, most gay and bisexual men who are in a monogamous relationship could donate blood. Guidelines are still in place for those who have been exposed to HIV.
Any individual who has ever had a positive test for HIV or who has taken any medication to treat HIV infection would continue to be deferred permanently.
Dr. Peter Marks with the FDA says people taking oral medications to prevent HIV, such as PrEP, would be deferred for 3 months, and those taking injectable PrEP would be deferred for 2 years. Dr. Liz Culler, who's the Chief Medical Officer of Blood Insurance in Chattanooga, says the company supports FDA's proposal.
Anytime you can maintain a safe and adequate blood supply, that's what we want to do. And I think that this is consistent with the other types of deferrals we have. For example, if let's say you're a healthcare provider and you get an accidental needle stick, then you're deferred for 3 months.
Dr. Culler says the need for blood supply continues. Since COVID, she's had to ask hospitals to cancel or delay about 8 elective surgeries because of the short supply. The FDA is not expected to reach a final decision until after a 60-day public comment period. Blood Insurance will adopt the new plan if approved.
We plan to have it live within 6 months of it coming out in the finalized state.
Dr. Fuller says as of now, there is only a 1-day supply for O-positive blood. She hopes the proposed measure can help increase that later this year.
O-positive and O-negative are our greatest need. We've had an increase in traumas during COVID, so that's where we could really need your help.
The full proposal can be found on our app. For Local 3 News, I'm Dallas Payton.